For the workflow on day 2, you would arrive at your computer and review the Admit Manage Workflow components. Let's start with documents. We can notice that there was an event note that occurred. The details in the event note: the patient developed respiratory distress and gross hemoptysis and was intubated and transferred to the ICU. You can also see the intubation note for further details. You may wonder if the patient has had their post-intubation chest x-ray performed. You can see that in the diagnostics component by clicking here, and notice that the endotracheal tube is in good position. You could then tag this information to use in your note later on. One of the consistent concerns that providers have when switching between PowerNote and DynDoc is the lack of a copy forward functionality. We are going to show you how to copy the admission H&P, physical exam, and assessment and plan into the progress note for the next day with a minimal time effort. Using the contextual view, select the admission H&P. Now scroll down to the physical exam, select the physical exam, and drag it into the progress note for the next day. You can also perform the same task for the assessment and plan section. This allows you to make edits to the assessment and plan instead of creating the entire assessment and plan de novo each day. Given the change in status, we should add acute hypoxemic respiratory failure as a diagnosis. Please note that this does not automatically update the assessment and plan for the daily progress notes. This is an intentional design decision to allow more free editing of the assessment and plan in the progress notes. In this scenario, we may want to add that diagnosis. We would then continue to review the items in the workflow components. Looking at the vital signs, we notice that the blood pressure has now become marginal. We may want to review the patient's medication list. Going to the order profile and selecting all active medications will show all current active medications. Reviewing this list, you may notice that the patient is currently receiving amlodipine. To discontinue amlodipine, click this checkbox and then cancel DC. That will place the order into the shopping cart. We can then add that information into our assessment and plan. Continuing our work, we can review the labs and notice the creatinine has improved. We can document that in our assessment and plan as well. We also may want to consult infectious disease. To do that, go to the new order entry and type in consult to physician. If then the nurse reports that they've had difficulty with IV access and the patient needs a central line, to document that, go to Documents and click Add. Then select a free text note and use the .cvc placement auto text which has been created. Fill in the details of the procedure. This auto text includes all of the required elements for CDC guidelines. Change the type to a procedure note and give it a title of Central Venous Access Procedure. After the nurse updates their information on the lines, tubes, and drains component, you can see the central line, the peripheral IV, a urinary catheter, and an endotracheal tube, including the insertion dates. Let's get back to completing the SOAP note. We can document the subjective part of the SOAP note right in the workflow page. We may also want to update the physical exam. After you have the documentation of your SOAP note, you can select either a SOAP note or an APSO note. Clicking on the APSO note in the bottom left corner, the APSO note will include the assessment and plan that you documented in the workflow page. You can continue to make edits on this note. In addition, it has a line item for VTE prophylaxis that will pull the most recent prophylaxis for that patient. It pulls the subjective from the workflow page. It also includes the past 24-hour vital signs, including maximum and minimum, the last oxygen therapy mode, as well as the past 24-hour eyes and nose. To get rid of any of these things that you do not want, you can simply click the X. It also pulls in the physical exam that you have documented. You can continue to make edits on this as well. It will pull in medications as well as lab results, and has a section for diagnostic results. If you have a tagged x-ray result, you can drag it from the tagged text section into this area. You are now done with your note on day 2. And this is the end of the video for day 2.